Point 1. The challenges of aging and the importance of addressing mortality. Aging and the onset of disease inevitably lead to a gradual loss of independence, compelling individuals to rely increasingly on family, healthcare systems, and social support networks. Although contemplating death and the decline of the human body is uncomfortable, it is an essential topic that must be addressed. Recognizing and preparing for this universal experience can help individuals and their families navigate these challenges with greater understanding and resilience. As we grow older, the natural processes of aging take a toll on our bodies. Organs lose their efficiency, muscles weaken, and bones become more fragile. These physical changes make routine activities increasingly difficult. For example, diminished muscle mass and strength contribute to higher risks of falls, often resulting in serious injuries like hip fractures. In the United States alone, approximately 350,000 elderly individuals experience hip fractures annually, underscoring the widespread impact of age-related physical decline. Aging also affects our internal systems. The heart, faced with stiffening blood vessels, must work harder to maintain adequate blood circulation. This additional strain often leads to conditions like high blood pressure, which become more prevalent among older populations. Similarly, the brain undergoes gradual shrinkage, which can impair cognitive function and lead to conditions such as dementia. These neurological changes not only hinder memory and decision-making, but also diminish a person's ability to live independently. The combination of physical and cognitive decline means that daily tasks, such as grocery shopping, cooking, or even basic hygiene, become increasingly challenging. As the aging process progresses, many individuals reach a point where they require constant care and supervision. This often results in transitions to nursing homes or long-term care facilities, where medical professionals and caregivers provide the support necessary to ensure safety and well-being. For many, the loss of autonomy that accompanies aging is difficult to accept. It forces individuals to confront vulnerabilities they may have avoided acknowledging earlier in life. However, understanding these realities is crucial. By openly discussing aging and death, society can work towards solutions that make these inevitable experiences less distressing. Whether through better healthcare policies, improved living environments for the elderly, or fostering stronger support systems within families, proactive measures can enhance the quality of life for those in their later years. Preparing for the challenges of aging also involves cultivating emotional resilience. Acknowledging the inevitability of decline allows individuals to focus on what truly matters, cherishing meaningful relationships, embracing moments of joy, and ensuring that end-of-life experiences are handled with dignity and care. Such an approach not only benefits the elderly, but also eases the emotional burden on their loved ones, creating a more compassionate and supportive environment for all involved. Point 2. The changing landscape of aging and dying in modern society. Advancements in modern medicine have significantly extended human life expectancy, enabling many people to live healthier and longer lives. In past centuries, illnesses occurring after the age of 50 often led to swift and inevitable deaths. Today, however, medical interventions can slow the natural deterioration of the body, helping individuals maintain their quality of life and delaying death. These developments have led to remarkable demographic shifts, with the proportion of elderly individuals in many countries rising substantially. In the United States, for example, the percentage of people over 65 has increased from just 2% to 14% over the past 2 centuries. And in countries such as Japan, Germany, and Italy, this figure now exceeds 20%. While these advances represent incredible achievements, they have also transformed how and where aging and dying take place. Historically, families served as the primary caregivers for their aging members. Generations often lived together under one roof or in close proximity, allowing elderly individuals to remain integrated in family life even as they became more dependent. As a result, many people could spend their final days surrounded by loved ones in the comfort of their own homes. For those without family support, however, options were grim. Impoverished elderly individuals often ended up in squalid poorhouses with little care or dignity. In modern times, this traditional family-centered caregiving model has largely been replaced by institutional care. Economic and social changes have dispersed families geographically, with adult children frequently living far from their aging parents. The demands of work and life make it challenging for many to provide full-time care for their elderly relatives. As a result, the responsibility for end-of-life care has shifted to medical professionals and institutions. Today, most deaths occur in hospitals or nursing homes rather than in private residences. For instance, in the United States, the percentage of deaths at home has fallen dramatically, from a majority in the mid-20th century to just 17% by the 1980s. This shift toward institutional care has both benefits and drawbacks. On the positive side, hospitals and nursing homes today are far removed from the appalling conditions of poorhouses in the past. These institutions are designed to provide clean, safe, and medically adequate environments for patients and residents. Skilled doctors and nurses deliver specialized care that families may be unable to provide, particularly for individuals with complex medical needs. In this sense, institutional care offers a level of professionalism and reliability that can greatly benefit the elderly and their families. However, these institutions often struggle to address the deeper emotional and existential needs of individuals nearing the end of their lives. While they excel at prolonging life and managing physical symptoms, they may fall short in fostering a sense of connection, purpose, and dignity for their patients. Many elderly individuals feel isolated and detached from the lives they once led, as the institutional environment often prioritizes efficiency and safety over personal fulfillment. This disconnection can leave people feeling unfulfilled during their final days, even in the presence of excellent medical care. To address these challenges, it is essential to reconsider what people truly need and desire at the end of their lives. Beyond physical care, there's a profound human longing for meaning, autonomy, and relationships. Creating environments that respect these needs can help ensure that aging and dying are not only safe and hygienic, but also deeply humane experiences. This requires a shift in focus from merely extending life to enhancing its quality, particularly in its final stages. By fostering open conversations about aging and death, society can develop more compassionate and holistic approaches to end-of-life care, ultimately enriching the experiences of individuals and their families during this universal journey. Point 3. The desire for autonomy and purpose in old age. Throughout our lives, independence is a value that shapes how we live and make decisions. When we are young and healthy, we enjoy the freedom to live on our own terms, making choices without external interference. However, as we age or face illness, this autonomy is inevitably curtailed by the limitations of our bodies and minds. Despite this, the desire to retain some level of control over our lives remains a fundamental aspect of our identity and well-being, even in old age. Losing complete independence does not mean we lose our sense of self. Instead, most people strive to adapt their lives in ways that preserve their core values and interests. For example, someone who has always enjoyed cooking may no longer have the physical strength to shop for groceries alone. Yet rather than relinquish this beloved activity entirely, they might prefer assistance with grocery shopping, allowing them to continue creating meals in their kitchen. This compromise ensures that they retain a sense of autonomy and purpose, even as their capabilities evolve. As people age, their perspective on life often shifts. The pursuit of novelty and ambition gives way to a deeper appreciation for familiar pleasures and relationships. Simple joys, such as spending time with loved ones or engaging in hobbies, take on greater significance. A study by Stanford psychologist Laura Carstensen illustrates this transformation. In her research, participants were asked to rank how much they would enjoy spending half an hour with various individuals, ranging from close family members to famous authors or public figures. Younger participants often favored exciting or novel interactions, while older adults and those living with life-threatening conditions, such as HIV, consistently prioritize spending time with close family and friends. This highlights how aging often brings a sense of contentment and an emphasis on meaningful connections. While many older individuals develop a more relaxed and fulfilled outlook on life, aging still carries its challenges. The fear of losing independence and becoming a burden often looms large. This anxiety is compounded by the shortcomings of medical and care institutions, which frequently focus on physical health while neglecting the psychological and emotional needs of the elderly. For many, the institutional environment can feel impersonal and restrictive, undermining their sense of autonomy and worth. To address these concerns, it is crucial to create systems of care that respect the autonomy and individuality of older adults. This involves more than just managing their physical needs. It requires an understanding of their personal goals, values, and preferences. Whether it is enabling someone to continue a cherished hobby or fostering closer connections with loved ones, small acts of recognition and support can make a profound difference in enhancing their quality of life. As we approach the later stages of life, the desire to maintain control and find purpose does not diminish. On the contrary, it becomes even more vital. By acknowledging and addressing these needs, society can create environments where aging individuals feel empowered, valued, and connected. This not only enriches their final years, but also provides comfort to their families, ensuring that dignity and autonomy remain central to the experience of aging. Point 4. The struggle for independence and warmth in elderly care. Medical institutions and doctors often fall short of meeting the deeper needs of elderly individuals, especially those nearing the end of their lives. Despite their primary focus on ensuring safety and providing essential medical care, many nursing homes and intensive care units inadvertently strip residents of their autonomy and fail to address their emotional and psychological needs. This systemic oversight leaves many elderly individuals feeling isolated, undervalued, and disconnected from their sense of self. The stereotype of nursing homes as dreary places filled with boredom and loneliness is, unfortunately, rooted in reality. In many cases, these environments operate on rigid schedules, prioritizing efficiency over individuality. Elderly residents, who once lived independently, suddenly find themselves subjected to strict routines that can feel dehumanizing. Personal privacy becomes a luxury, and decisions about their own lives are often made without their input. While these structures aim to ensure smooth operations, they leave little room for the personal agency that is so vital to maintaining a sense of purpose and dignity. Caregivers, while undoubtedly hardworking and well-intentioned, may contribute to this issue by prioritizing convenience over empowerment. For example, helping a patient dress themselves might take longer than doing it for them, but the latter approach can undermine their confidence and sense of capability. Small acts of assistance that preserve independence are crucial for fostering a positive self-image among the elderly. Neglecting these opportunities, even with the best intentions, can make residents feel powerless and insignificant. Despite their shortcomings, nursing homes and medical institutions excel at providing basic medical care and ensuring physical well-being. Staff members work tirelessly to wash, feed, and medicate their patients. However, this focus on physical care often comes at the expense of emotional connection and understanding. Just as people in other stages of life need to feel valued and appreciated, the elderly crave warmth, attention, and recognition. Unfortunately, these needs are often overlooked, leaving many residents feeling like little more than recipients of clinical services. One significant factor contributing to this lack of warmth is the chronic understaffing in elderly care facilities. There's a notable shortage of geriatricians, doctors specializing in the medical care of older adults, and the few available are often overwhelmed by their responsibilities. Similarly, nurses and caregivers face demanding workloads, leaving them with little time to provide the emotional support that residents need. This structural issue limits the ability of institutions to create environments where residents feel genuinely cared for and respected. The absence of personalized care in medical institutions places a heavy burden on families, who are often seen as the only viable alternative to institutionalized neglect. While families can provide love and attention that institutions may lack, managing the complex care needs of an elderly or sick relative is no easy task. Family members may lack the necessary medical expertise or resources, and their decisions, though well-meaning, are not always in the best interests of the elderly individual. This highlights the need for a more balanced approach that combines professional medical care with a commitment to preserving autonomy and emotional well-being. Addressing these challenges requires a fundamental shift in how society approaches elderly care. Institutions must go beyond merely ensuring safety and physical health to prioritize the psychological and emotional needs of their residents. This involves creating more flexible and personalized care models that respect individual preferences and foster a sense of community. Providing opportunities for residents to make their own decisions, engage in meaningful activities, and maintain their personal dignity can transform nursing homes into places of empowerment rather than confinement. Additionally, addressing staffing shortages and reducing caregiver workloads are essential steps toward improving the quality of elderly care. With more time and resources, caregivers can focus on building genuine connections with residents, helping them feel valued and understood. Investing in training programs for geriatric care professionals can also enhance the overall quality of care, ensuring that the unique needs of the elderly are met with compassion and expertise. Ultimately, the goal of elderly care should be to preserve the independence and humanity of individuals while providing the support they need to navigate the challenges of aging. By fostering environments that prioritize dignity, respect, and emotional connection, society can ensure that the later years of life are as meaningful and fulfilling as possible. This approach not only benefits the elderly, but also brings peace of mind to their families, creating a more compassionate and supportive framework for end-of-life care. Point 5. Balancing quality and quantity of life in end-of-life decisions. When faced with terminal illness or the natural decline of aging, many people and their families instinctively focus on pursuing treatments that might extend life, even at the expense of the quality of the time they have left. This preference often leads to aggressive medical interventions that, while aiming to buy more time, can make the patient's remaining days fraught with physical and emotional suffering. Striking a balance between prolonging life and ensuring its quality is one of the most challenging and deeply personal decisions in end-of-life care. In the United States, a staggering 25% of healthcare costs are devoted to treatments for patients in the final year of their lives, even though they make up only 5% of the total patient population. While some of these treatments are vital for managing pain or addressing specific symptoms, many are ultimately futile attempts to delay an inevitable outcome. Both patients and their families often cling to the hope of a miraculous recovery, even when the odds are overwhelmingly against success. This hope can lead to decisions that prioritize life extension at any cost, often without considering the profound toll on the patient's physical and emotional well-being. Doctors play a critical role in shaping these decisions, yet they, too, face significant challenges in navigating these conversations. Many physicians are reluctant to confront patients with the full reality of their prognosis, fearing that doing so might extinguish hope or strain the doctor-patient relationship. As a result, they may offer treatments that they believe are unlikely to succeed. Studies reveal that more than 40% of oncologists have, at some point, recommended treatments they knew were unlikely to help, driven by the desire to support their patients' hopes or under pressure from families. The consequences of such decisions can be profound. Aggressive treatments, such as chemotherapy for terminal cancer patients, often come with severe side effects, including debilitating nausea, exhaustion, and pain. While these treatments may offer a slim chance of extending life, they can also strip patients of the ability to enjoy the time they have left. Instead of meaningful interactions with loved ones or peaceful moments of reflection, Their final days may be consumed by hospital visits, invasive procedures, and the side effects of medications. Research highlights the stark differences in quality of life between those who pursue aggressive treatments and those who opt for palliative care or hospice services. The American Coping with Cancer Project found that terminally ill cancer patients who chose to stop intensive treatments and spend their remaining time at home or in hospice care experienced significantly better quality of life in their final weeks. These patients often reported greater emotional peace, reduced physical discomfort, and more opportunities to connect with their loved ones. In contrast, those who continued aggressive medical interventions frequently faced higher levels of anxiety, discomfort, and isolation. The focus on prolonging life at all costs raises difficult questions for patients, families, and healthcare providers alike. When should we fight against illness? And when should we prioritize comfort and dignity over continued treatment? How can we make decisions that honor both the patient's desire for independence and their need for care? These questions are deeply personal, yet they're also shaped by broader societal attitudes toward aging, death, and medical intervention. To address these challenges, society must embrace care models that prioritize both independence and meaning in the final stages of life. Palliative care and hospice services, for example, offer a compassionate alternative to aggressive treatments, focusing on pain management, emotional support, and helping patients maintain a sense of agency. These approaches acknowledge that while medical interventions can be life-saving, they are not always life-affirming. By shifting the focus from merely extending life to enhancing its quality, these models help patients and families navigate the complexities of end-of-life care with greater clarity and compassion. Ultimately, the decisions we make about how to approach the end of life should be guided by a commitment to respecting individual values and preferences. This involves open, honest conversations between patients, families, and healthcare providers about what matters most, whether it is living as long as possible, avoiding pain, or spending meaningful time with loved ones. By fostering these discussions and supporting care models that prioritize quality of life, we can ensure that the final chapters of life are not defined by suffering or regret, but by dignity, connection, and peace. Point 6. Balancing independence and meaning in aging and end-of-life care. Modern medical care, while effective at addressing physical ailments, often falls short in meeting the deeper emotional and psychological needs of those facing the end of life. For individuals to age and die well, it is essential to create systems that honor their autonomy while providing the necessary support and compassion. A shift in how society approaches aging and death is needed, with a focus on preserving both independence and a sense of purpose. One promising approach is assisted living, which seeks to provide the essential services of nursing homes without the rigidity and control that often characterize them. In assisted living facilities, residents are afforded the freedom to make decisions about their own lives. They can arrange their living spaces to feel like home, determine their daily routines, and choose the level of assistance they require. This emphasis on personal agency helps individuals maintain a sense of control over their lives, fostering dignity and self-worth. Beyond assisted living, innovative and alternative models of elder care have demonstrated remarkable results in enhancing the quality of life for residents. For instance, a nursing home in New York transformed its environment by integrating a garden, bringing in 2 dogs for cats and 100 birds, and arranging regular visits from local kindergarten children. These changes provided residents with opportunities to care for living beings and interact with the vibrancy of youth. The results were astounding. Within 2 years, the number of prescriptions per resident was cut in half, and the annual death rate dropped by 15%. These outcomes underscore the profound impact that meaningful engagement and a nurturing environment can have on both physical and mental health. The success of these innovative approaches lies in their ability to give residents a renewed sense of purpose. Activities like caring for plants and animals or spending time with children instill joy and provide a reason to live. They transform the experience of aging from one of passive decline to one of active participation in life. Such models illustrate that elder care can go beyond meeting basic needs to genuinely enrich lives, creating environments where individuals feel valued and connected. Hospice care, too, plays a crucial role in supporting individuals during their final days. Unlike traditional medical treatments that often focus on prolonging life, hospice care prioritizes the quality of the time that remains. Nurses, doctors, and social workers in hospice programs work to ensure that patients can live as fully as possible, addressing not just physical pain, but also emotional and spiritual well-being. This holistic approach helps individuals and their families navigate the complexities of terminal illness with grace and dignity. To make these models more effective, society must foster open and honest communication about aging and death. Patients need to feel comfortable expressing their preferences and priorities to their families and doctors. Similarly, healthcare providers must be willing to listen and adapt their care plans to align with the values and desires of their patients. By building these conversations into the care process, we can ensure that the support provided truly reflects the individual's needs and aspirations. As we rethink how we manage aging and end-of-life care, it becomes evident that a one-size-fits-all approach is inadequate. Different individuals have different needs, and care systems must be flexible enough to accommodate this diversity. Whether through assisted living, innovative elder care models, or hospice services, the goal should always be to preserve independence and infuse life with meaning. By doing so, we can create a society that not only respects the elderly, but also celebrates their continued contributions to the world around them. Point 7. The vital role of doctors in guiding patients through the end of life. The relationship between doctors and their patients becomes particularly delicate when terminal illness is involved. For those facing the end of life, clear and compassionate guidance from their healthcare providers can make an immense difference in how they spend their final days. Doctors, however, often struggle to strike the right balance between their professional responsibility and natural empathy. To provide meaningful support, they must adopt a nuanced approach that blends medical expertise with a deep understanding of their patients' priorities and values. Doctors should neither dominate nor withdraw from the decision-making process when dealing with terminally ill patients. Acting as authoritarian figures who dictate the course of treatment can alienate patients and diminish their sense of autonomy. On the other hand, offering only information without any guidance can leave patients overwhelmed and unsure of how to proceed. Instead, doctors must find a middle ground, serving as trusted partners who help patients navigate complex choices with clarity and empathy. A critical part of this role involves understanding what truly matters to the patient. For some, it might be the ability to continue engaging in a beloved activity, like playing tennis or gardening. For others, it might mean spending meaningful time with family or avoiding prolonged discomfort. By having honest conversations about these priorities, doctors can align their medical recommendations with what the patient values most. This might mean choosing treatments that optimize quality of life, even if they come at the expense of longevity. For instance, a terminally ill patient who values mobility and independence might prefer a less aggressive treatment that allows them to maintain these abilities for as long as possible. Conversely, another patient might prioritize maximizing their time, even if it involves enduring more intensive medical procedures. By actively listening to their patients, doctors can provide options that honor these preferences, ensuring that the care plan reflects what the individual finds most meaningful. In some extreme cases, patients may express a desire to discuss assisted dying, particularly if they are experiencing unbearable pain or suffering. While this is a contentious topic and remains illegal in many places, it is essential for doctors to approach these conversations with openness and sensitivity. Even if active assistance is not possible, acknowledging the patient's feelings and helping them explore their options can provide comfort and clarity. These discussions can also help patients prioritize what they want from their remaining time, guiding them toward decisions that align with their values and reducing feelings of helplessness. As the processes of aging and dying increasingly involve medical professionals, there's a growing need for doctors to develop stronger communication and listening skills. Beyond offering technical expertise, They must be adept at fostering trust and understanding. This means creating a safe space for patients to express their fears, hopes, and goals, and responding with honesty and compassion. By improving their ability to connect with patients on a human level, doctors can provide care that goes beyond the physical, addressing the emotional and psychological dimensions of end-of-life experiences. Ultimately, the goal of end-of-life care should not be limited to prolonging life, but should also focus on ensuring that the time remaining is as fulfilling and meaningful as possible. Doctors play a pivotal role in achieving this balance, guiding patients through the complexities of terminal illness with wisdom and empathy. By prioritizing open communication and aligning treatments with individual values, they can help patients navigate the end of life with dignity and peace. Point 8. The importance of open conversations about aging, illness, and mortality. Discussing aging, illness, and death is often seen as uncomfortable or even taboo. Yet these conversations are essential for ensuring that we and our loved ones face the end of life with clarity, dignity, and purpose. Many families avoid these topics, choosing instead to delay such discussions until they are forced to make difficult decisions under pressure. Unfortunately, this reactive approach often leads to hasty choices and missed opportunities for meaningful goodbyes. By addressing these issues early and openly, families can make informed decisions that honor individual wishes and values. One of the most important steps in preparing for the challenges of aging and mortality is to explore personal priorities and trade-offs. Questions like what will matter most in your final days, or what makes life worth living for you, can help clarify these priorities. The answers to these questions may not come immediately, but the process of discussing them can provide valuable insights. For instance, some people may prioritize avoiding pain above all else, while others might value maintaining independence or spending time with loved ones, even if it involves some discomfort. These discussions not only guide decision-making, but also give individuals a greater sense of control over their lives, even in the face of uncertainty. Having these conversations becomes even more critical when individuals lose the ability to make decisions for themselves. In such situations, family members often find themselves responsible for determining what is best. Without a clear understanding of their loved one's wishes, families may struggle to navigate the complex choices surrounding medical care, leading to unnecessary stress and conflict. Early discussions can provide a framework for these decisions, ensuring that the individual's preferences are respected and reducing the emotional burden on their loved ones. Confronting mortality can also be an empowering experience. By acknowledging the inevitability of death, individuals can take an active role in shaping their legacy and deciding how they want to be remembered. This sense of agency can bring a profound sense of purpose, even in the face of terminal illness or declining health. For example, the author shares the story of his daughter's piano teacher, who, despite battling terminal cancer, chose to spend her final days giving one last piano lesson to each of her students. Through this act, she ensured that her influence as a teacher would live on in the music of her students, leaving a lasting impact that transcended her physical presence. Openly discussing aging and death also has broader societal benefits. When individuals, families, and communities embrace these conversations, they can collectively work toward making the end-of-life experience less painful and more meaningful. This might involve advocating for better healthcare policies, creating support systems for caregivers, or simply fostering a culture where people feel comfortable expressing their hopes and fears about mortality. By normalizing these discussions, society can help individuals find purpose and meaning in their final chapter of life. Ultimately, the process of addressing aging, illness, and death is not just about preparing for the end. It is about living fully until the very last moment. By engaging in honest and compassionate conversations, families can strengthen their bonds, reduce uncertainty, and ensure that their loved ones' final days are marked by dignity, connection, and peace. These discussions, while challenging, hold the potential to transform the way we approach life's most difficult moments, allowing us to face them with courage and grace. Point 9. Conclusion. Mortality is an inevitable part of life, yet it is a subject many of us hesitate to confront. By accepting this reality and preparing for it throughout our lives, we can ensure that our final years are meaningful and aligned with our deepest values. This preparation involves thoughtful reflection, open communication with loved ones and medical professionals, and active efforts to improve the quality of life in environments like nursing homes and hospice care. One of the first steps in preparing for the end of life is identifying what matters most to us. This requires honest introspection about what gives our lives meaning and joy. For some, this might involve maintaining a sense of independence, while for others, it could mean spending quality time with family or engaging in a beloved hobby. These personal values should guide our decisions about how we want to live as we age and face the challenges of illness or frailty. Sharing these values with family, friends, and doctors is equally important. Open conversations about priorities, fears, and hopes help ensure that our wishes are understood and respected. This clarity is particularly valuable in situations where we may no longer be able to advocate for ourselves. By expressing our preferences early, we empower those around us to make decisions that align with our desires, reducing uncertainty and stress during critical moments. For individuals who spend their later years in nursing homes or similar care facilities, efforts to improve the environment can significantly enhance their quality of life. Traditional nursing homes often prioritize safety and efficiency over individuality and fulfillment, leading to a sense of monotony and isolation. Transforming these spaces into vibrant, engaging communities requires creativity and a commitment to addressing residents' emotional and social needs. Examples of successful transformations include introducing elements that foster connection and purpose. Some facilities have incorporated gardens, pets, and regular visits from children, creating opportunities for residents to care for living beings and engage in meaningful interactions. These initiatives have been shown to reduce dependency on medications, lower mortality rates, and improve overall well-being. By focusing on what brings joy and purpose to residents' lives, nursing homes can become places of vitality rather than mere custodial care. Hospice care plays a crucial role in ensuring that individuals can spend their final days in comfort and dignity. Rather than emphasizing aggressive treatments that may prolong life at the cost of quality, hospice care focuses on managing pain, providing emotional support, and helping patients make the most of their remaining time. This approach aligns with the broader goal of end-of-life care, to honor personal values and priorities while minimizing suffering. Preparing for the end of life also involves accepting mortality as a natural part of the human experience. Far from being a source of despair, this acceptance can be liberating. It allows us to focus on what truly matters, foster meaningful connections, and leave behind a legacy that reflects our values. For example, individuals facing terminal illnesses often find ways to make their final days impactful, whether by spending time with loved ones, creating art, or imparting knowledge to others. By embracing the reality of death and taking proactive steps to prepare for it, we can make our final years as enriching and purposeful as possible. This preparation not only benefits us, but also provides comfort and clarity to our loved ones, creating a shared sense of peace and understanding. Through thoughtful planning, open dialogue, and a commitment to improving care environments, we can approach the end of life with courage, dignity, and grace.